Hello everybody, my name is Irlanda Hernandez and today we will be discussing about exercises and body planes. First of all, I want to begin with explaining to you why body planes are crucial in medical careers. Well, healthcare professionals use body planes because it's important for accurately describing locations and diagnosing conditions of patients, also in performing medical procedures. They also provide a clearer vision in dividing the body in sections to perform such tasks. It's basically a universal language for describing a body structure. And as you see in the following picture from our lab book in page 4, our body has 3 body planes. 1, a sagittal plane, 2, a frontal plane, and 3, a transverse plane. This module right here represents a sagittal plane, which divides the body into left and right, while this module represents a frontal plane, which divides the body into anterior and posterior sections. This right here is a transverse plane. It divides the body into superior and inferior parts of the body. Body planes, like mentioned before, are important because they provide a standardized way to describe the body structure, movements, and orientation of internal organs. Today, we will be discussing about how the body planes help define the directions that the body moves within and its motion of body organs when performing such movements, as well as the organ orientation in such body planes. For example, this is Janie. She's performing a squat in a sagittal plane, which basically is a movement along a vertical plane. A squat facilitates movement in a sagittal plane because it involves forward and backward motions of flexion and extension. When performing the squat, she creates a up and down movement, aligning with the vertical line which divides the body into left and right, like a sagittal plane does. This up and down movement that she creates when performing the squat facilitates body movement by creating flexion and extension. The bending of the knee when she goes down is flexion, and when she straightens the knee when standing back up is extension. When Jenny is squatting in a sagittal plane, organs are compressed due to flexion of the knees when bending down, especially those organs in the abdominal and pelvic areas. For example, the bladder. The motion of the bladder throughout the squat is inferiorly when flexion of the knee occurs. The bladder can be viewed in a sagittal section between the pubic symphysis, which is located anteriorly, and the uterus posteriorly in Jenny's body since she is a female. Another organ would be the stomach, which moves inferiorly during a squat due to the compression in abdominal cavity. The stomach can be viewed in a sagittal plane between the esophagus and the beginning of the small intestine. Now, Jenny is performing a lateral raise in a frontal plane, which basically is a movement that includes away and toward body midline movements, dividing the body into an anterior and posterior parts of the body. Lateral raises facilitate body movement in a frontal plane because it involves abduction and adduction. Abduction is created when her limbs go away from her body midline, meaning when she raises her limbs laterally, and adduction when there's movement of limbs toward her body midline, as she demonstrates in the video. When Jenny is doing lateral raises in a frontal plane, organs like the deltoid and trapezius muscles move superiorly and inferiorly when elevating the arm to carry out the lateral raise. These muscles are located between the largest organ of the body, the skin, and underneath there is no organs like such, but there are nerves and joints. Lastly, Jenny is performing a Russian twist in a transverse plane, which is a movement at the center of the body or a rotation around a vertical axis. Russian twist facilitates movement in a transverse plane because it involves rotation and twisting of the torso, movement in the center of the body. When performing Russian twist, Jenny is creating a supination and pronation motion of the forearm. When carrying out the Russian twist, the forearm rotates laterally so the palm of the hand faces anteriorly. This is called supination, and when the forearm rotates medially so the palm of the hand faces posteriorly, this is called pronation. When performing a Russian twist in a transverse plane, the rotation along the center of the body and the vertical axis causes the kidneys to move inferiorly and superiorly. The kidneys can be found in between anterior the liver and posterior the abdominal wall with the muscles. The liver is another organ that moves laterally in a transverse plane, meaning it's less closer to the body's midline, moving away from the midline when rotating the center of the body in Russian twists. The stomach is anterior of the liver and the pancreas is posterior to the liver.